Today, our phenomenal speakers include Mike Flores of McDonald's, the incredible Dr. David Gaus, winner of the Dr. Thomas A. Dooley Award and co-founder of Andean Health, and the esteemed Harry Kraemer, former chairman and CEO of Baxter International. So let me begin with Mike Flores. Mike Flores heads up the worldwide development for McDonald's Corporation, supporting the development and execution of new restaurant growth plans and the strategic management of his enterprise portfolio for McDonald's. 28 years with McDonald's, Mike has done it all, from mopping the floors to making Big Macs to managing global strategy. Mike is a 1983 graduate of the University of Notre Dame in accounting. He completed postgraduate work with executive education at the University of Michigan and the University of Chicago. He initially launched his career as a CPA with Ernst & Young before joining McDonald's. Mike lives in the Chicago area with his wife, Kate, graduate of St. Mary's College in '83. They have 3 children, Bridget, Jack, and Bobby, all of whom have graduated from our beloved university. Please welcome Mike Flores.
Good afternoon, everybody, and you may have prematurely graduated my last son, but he'll be happy to know that he's at least on track. So I'm going to try to be brief here because we definitely want to get to the headliner acts. I met David Gaus 8 years ago, and I was really inspired. So I decided to introduce David to my friends at Ronald McDonald House Children's Charities, physicians and business executives and NGO leads who share his passion for helping the underserved, and they were truly inspired. So David's first grant request was fairly modest. It was a few $1,000s to buy an old 4x4 that he converted into an ambulance, still running today, I guess, huh? So he obviously has some other skills. His story, which you're going to hear today, and it normally takes hours, but David, we've limited you to about 10 minutes, so see what you can do with that. It is a tremendous story of leadership and service in the developing world, and it really is a true continuation of Father Ted's legacy. And I'm so excited that Harry Kraemer is going to be joining us today. Harry is, as you heard, the former chairman, chief executive of Baxter International, and today he splits his time between teaching executives at the and executives to be at the Northwestern Kellogg School of Management, and then also he's a partner with Madison Dearborn, where he consults with CEOs and other senior executives within the vast Madison Dearborn portfolio of clients. Harry is a teacher in the truest sense. He helps students and executives alike unleash their potential to do real good. And just ask his Kellogg students, because they had voted him Professor of the Year in 2008. So congratulations on that, Harry. So with David and the Andean Health and Development story as a backdrop, Harry's going to challenge us to really reflect on how we bring our values to life through our own leadership actions. So now to David Gaus. David graduated from Notre Dame in 1984 with an accounting degree. After a brief stint in business, he had a soul-searching conversation with Father Ted, who was then the university president, and he was convinced that his destiny was not in the accounting world, and he embarked on a 2-year volunteer mission in rural Ecuador. There he witnessed the marginalization of a population of mostly women and children who lacked even the basic access to health care. The experience was profound and changed David's life forever, and I would think you would agree after this. It's gone on to change the lives of thousands and thousands of people. So he returned to the U.S. to complete his pre-med studies at Notre Dame, then went on to earn his MD and his master's in public health and tropical medicine at Tulane, and then completed his residency in family medical practice at the University of Wisconsin. He then returned to Ecuador, and his thought at the time was that primary health care, the prevention and health education, that was the country's greatest need, but that perspective soon changed. When a young boy died in David's truck on a 4-hour trip to the Capitol to get treatment for a snake bite, David realized that what the community had been telling him all along was true, that they needed a hospital. So in 1996, David and Father Hesburgh started Andean Health and Development to provide self-sustainable, comprehensive health care to poor rural areas in Latin America, with their pilot project being the construction of a hospital in the rural community of Pedro Vicente Maldonado. It opened in 2000, and 7 years later, it became 100% financially self-sustainable. So when he's not in Ecuador or on the road raising funds, David lives with his wife, Elizabeth, and his 3 bilingual and very bicultural children in Madison, Wisconsin. And in addition to being the executive director for Andean Health and Development, David serves as the assistant clinical professor of medicine at the University of Wisconsin. So, ladies and gentlemen, please prepare to be inspired, David Gaus.
Good afternoon, and thanks for asking me to be here today to tell my story, our story, about Father Hesburgh and leadership. Chicago is a great place to do this story and tell this story because it's home to arguably the greatest Notre Dame club in the country, if not the world, right? From a university, frankly, that has generosity and social justice running through its institutional veins. Today is a day to celebrate Father Ted's leadership. His leadership for me personally, and for a group of Americans and Ecuadorians during the past quarter century in another part of the world. It's not an overstatement for me to say that my life was drastically changed by Father Ted, who really personally taught me what leadership is all about, taking chances on that which is important to oneself and which can benefit others. My life has been quite simply dedicated to doing my best to fulfill the incredible leadership role model that he has been for me all these years. This story really speaks to the heart of the Notre Dame global family and is now culminated in the construction of Hesburgh Hospital in Ecuador, South America. Now, with us today is Mr. Harry Kraemer, and he was previously announced. He's the former CEO of Baxter International, one of the greatest healthcare companies in the world, and is also founded right here in Chicago. And it'll be my privilege to listen with you to his enormously successful story as a leader and an author. Harry's life really does embody the leadership as well as the spirit, goals, and accomplishments of Father Ted as well. But before we hear Harry's inspiring story and insights, I'd like to tell you a little bit about where Father Ted's leadership and inspiration have led me personally and our foundation. And by the way, he's been our chairman for over 20 years now. My hope is to inspire you to learn more about this Notre Dame-driven project and join all the other members of the global Notre Dame family in helping us complete our most ambitious project to date, Hesburgh Hospital. And by the way, we did not want to call this Hesburgh Hospital. It was at the request of the Ecuadorians, who really deeply understand Father Ted's vision for this foundation, who insisted that this be called Hesburgh Hospital. I'd like to share with you 5 key points about Andean health and development over the next few minutes and its story. Number 1, almost 30 years ago, Father Ted took a chance on me, like he's done with many other Notre Dame students not sure what to do with their life, and suggested that I take a feeling that I had developed after spending those 2 years as a volunteer in Ecuador after graduating with that accounting degree back in '84, and to take that feeling and to turn it into my life's mission to dedicate myself to developing smart, effective, accessible, and affordable health care to some of the poorest people in South America. And by the way, if there are any students out there who are wondering what to do with their lives, it's only a short flight up the steps to the 13th floor of the library. Father Ted's still around for consulting services. And very simply, this has been and remains the heart and soul of what Andean health and development is all about, creating long-term, sustainable healthcare solutions for some of the poorest people on earth. And I will tell you that one of the ugliest manifestations of poverty that I have ever seen is a poor, uneducated campesino with a significant medical problem who has no access or even hope of access to health care. That was number one. Number two, our first hospital, Hospital Pedro Vicente Maldonado. It's a tongue twister. Sometimes I can't even pronounce it. It's called that because that's the town that it's in. We think this is a fairly unique hospital in Ecuador and perhaps all of South America. Now, it's not a typical missionary hospital like Tom Dooley had created or people like Albert Schweitzer. It's got a little bit of a different twist to it. So why is it unique? Well, first of all, it's completely locally run by Ecuadorians. I'm not there anymore. They don't need me on a day-to-day basis. It runs better than when I was there, actually. And it serves a community of about 80,000 people. It's a high-quality service hospital. If you saw our operating rooms, you'd say, I feel like I'm at Rush Presbyterian or at Northwestern or any other hospital in America. It's got state-of-the-art technology on the service side of it. And it takes care of everybody that comes into the place, regardless of their ability to pay. Thirdly, it's financially self-sustainable, which is probably one of its greatest attributes. Let me say that again. Yeah, we needed money to build it. Yeah, we needed some working capital for the first couple of years, several years, to get through the operating deficit. But after 7 years, that hospital runs all by itself without needing a dime from the outside. And it all does it through local financing mechanisms in Ecuador. Next, it's a teaching hospital. What Hesburgh-related hospital wouldn't be a teaching hospital, right? It trains doctors, it trains nurses, it trains administrators to take care of the sick, but actually also to become leaders in the health sector, impacting policy and quote-unquote moving the needle. Several of our graduates already have high-ranking positions in the health sector in Ecuador. Next, we employ 21st century technology. None of this, well, it's good enough for the poor. We really bring in state-of-the-art technology, not only for the service side, but actually for the training side. So things like simulation technology that we've been working with Northwestern University here, also thanks to the Ronald McDonald money that came in to build our simulation lab. Virtual libraries, electronic medical records. As Father Ted and I have talked about on many occasions, the world, predictably, has changed drastically since the Dooleys 50 years ago. We have new amazing technology and a means to deliver it to underserved populations in a way that could scarcely be dreamed of 50 years ago. And it's not a standalone hospital. We understand that hospitals don't make people healthy. Health is not practiced within the walls of a hospital. So we form partnerships with ministries of health, with social security systems, with municipal governments to make sure that we understand we're part of a bigger network of healthcare providers, and we try to impact and catalyze that network to help it be better and to teach us what we need to know about them. So that was number two. Number three, our new hospital, Hesburgh Hospital in Santo Domingo, Ecuador. Our first hospital served a community of 80,000. This new hospital will serve a community of 400,000 people. Training. We're currently training 6 residents per year in our family medicine training program. With Hospital Hesburgh, we'll train over 100 physicians, nurses, as part of a government-sponsored nationwide program. It too will be self-sustainable after a few years. And finally, part of the Hesburgh Hospital, it will be home to the new Global Health Research Center, whose principal purpose is to develop leadership and the new leaders. Here, we'll train those physician leaders to apply our model around Ecuador and hopefully beyond. And the requests are already coming in. This is where we will have the privilege and the opportunity to take that Hesburgh leadership that I learned from him and be able to spread it around Ecuador via the health sector. Number 4, we're really close to finishing it. We're 60% done. We're very close. Now, hospitals aren't cheap. You guys know that. But I'll tell you, in Ecuador, we figured out how to build well and how to build affordably. That first hospital with 17 beds in it, $800,000. $800,000 to build and equip that hospital. That's what it cost. Now, Hesburgh Hospital is a bigger place. It's about 4 times that size. But it's more than just a hospital. It's a campus. It'll be practically a university in and of itself. It'll even have a grotto. How beautiful is that? This one's going to cost about $3 million. And it too will, as I said, however, will eventually be financially self-sustainable and be able to do all the things in a much shorter time than the first hospital. And my last point is this, and this is it. I humbly stand before my Notre Dame family today to say that there stands before us an opportunity to do something really extraordinary right now, something inspired by Father Ted. This project started in a community of 15,000 people in rural Ecuador in 1997. Now, right now, Ecuador, a country of 12 million people, is literally waiting for us to step up to the challenge of transforming healthcare and healthcare services and medical education through the introduction of Hesburgh Hospital. And you know what? We can do it. And when I say we, I'm not talking about the United States government. I'm not talking about the Gates Foundation. I'm not talking about the Peace Corps. I'm talking about the Notre Dame global family leading the charge for social justice. Father Soren had a bold dream for a great university. Hesburgh took us there and beyond. If Hesburgh's Notre Dame could transform Catholic higher education around the globe, and it did, if Ted Hesburgh could give critical leadership to the civil rights movement in the United States in the 1960s, and he did, Hesburgh Hospital will transform medical education and health services in Ecuador and quite possibly all across Latin America. And so Notre Dame, if you find a place in your heart for this, let's do what we do best. Let's get this done. Hesburgh Hospital, taking Hesburgh leadership and spreading it throughout Ecuador and beyond. Thank you very much. And now, ladies and gentlemen, I give you a leader's leader, Mr. Harry Kraemer. Harry, come on up.
Thank you, Dave. Well, good afternoon, everybody. Good afternoon. I have to say it is a great honor and a privilege to be with all of you. I have, over the last 15 months, been very fortunate to become part of this Notre Dame family. I had no idea what I was getting myself involved in, but my daughter is a sophomore. And just to give you a sense of this, I'm fortunate now. I spend half my time teaching at Northwestern Kellogg, but I'm also involved with Madison Dearborn, which led to the issue that I was at a staff meeting. I think it was about a year and a half ago, and I happened to make the mistake of sitting next to Pat Eilers. And Pat said, "Well, where's your daughter going to school?" And I said, "Well, Pat, she's applied to Notre Dame and Northwestern, but I think she's going to be going to Northwestern." And he said, "Oh, that's interesting." So that night, around 10 o'clock at night, there was a ring at the doorbell, and it was Pat, and I thought, I'm not working on any deal with Pat. I'm surprised Pat's here. And he said, "I'm not here to see you. I'm here to see Shannon." And he came in the house. He had a sweatshirt and a bag, and I was just sort of listening, and he had a very interesting way of saying, he said, "You know, Shannon, you need to understand, Northwestern is a great school. I went to graduate school there. Your father did. It's a great school. But we're not talking about graduate school. We're talking about the 4 most important years in your life." The next day, Shannon started singing the Notre Dame fight song, okay? And I have 4 sweatshirts that say Notre Dame Dad on them, okay? And I think I get some email related to Notre Dame about every 3 hours. So I've gotten into this in a big way. One of the things, though, that I am most impressed with, and I mean incredibly impressed, and I know my wife Julie feels the same way, is to have an institution that is very focused on developing leaders, and at the same time they're focused on their education and their health. there really is an understanding that it all is about our spirituality. It all is about what kind of people we want to be and what kind of values we have. And I have to say, every person that I've met, whether it's at the school or as alumni, I actually believe has a really good understanding of what this value-based leadership is all about. And very often as I go around and I visit companies and schools and associations, and I'm sure you see this in all of your jobs, a lot of people will see what the issues are, and they will see whether it's the situation in Ecuador, the situation in China, India, wherever we are, people can have a very interesting discussion about, that's a real issue. That is a real problem, and somebody needs to do something about it. And I think most of the time, with a lot of folks, the response to this fact that there's a problem, there's a group of people that they actually believe will take care of it. And it's interesting, the name of this group of people is virtually the same in every organization. They're referred to as those guys. There is this group of people, when I say guys, men or women, there's a group of those guys that are going to take care of these things somehow. And I really have come to believe that one of the great things, one of the great blessings about people from Notre Dame is that most of the people I meet from Notre Dame actually realize we are those guys. We can talk about, as David said, what's the government going to do, what's this going to do, but we are those guys. And what difference can we make rather than waiting for somebody to do something about it? What difference can that be? So one of my focuses these days, being very fortunate to teach, and I've had the opportunity now a number of times to teach at Notre Dame for Father Scully, because I'm realizing he's another one of these guys who when he calls, you have to show up, I understand. We talk a lot about this whole issue of, in a practical way, what really is this value-based leadership? We talk about the fact we don't have enough leaders, we don't have enough leaders in government, academia, business, but not a lot of people get very specific, very concrete as to what do we really need to do to develop these leaders. And the more I think about it, I actually think it's pretty simple. And a lot of these are things that all of you become pretty accustomed to. The first one for me is that somebody who's going to be a value-based leader literally takes the time to be self-reflective. And I've actually convinced myself that this really is the first principle. Because if you think about most of us in this room, we probably have way more things to do than we're ever really going to get done. You think about our job, our career, family, spirituality, health, a little exercise, a little sleep, making a difference. There's a lot of things to do. And when you realize there's a lot to do and not a lot of time to do them, usually we end up saying, well, we'll just go faster and faster. This is where the whole ability to multitask comes in. I'm driving down here, trying to get down here on time. I noticed that people on the outer drive, if you actually watch them, they're driving, they're texting, they're eating a Big Mac, they're shaving. There's a lot going on, right? This is a moving vehicle, all right? And why I've come to conclude that the first principle of leadership is that people that are value-based leaders take the time to turn off the noise, turn off the gadgets, and actually ask themselves a couple of fairly personal questions. What are my values? What do I stand for? What really matters? And this is not an advertising thing, but I'm looking in the mirror. What am I all about? What kind of example do I want to set? For the very short period of time I'm in existence, what difference am I called to make? And I think taking the time to do that, and by the way, I sometimes have to remind the students, when you define terms, what something is not. When I say self-reflection, this is not self-absorption. This isn't spending hours contemplating your navel. This is, what are my values and what am I going to do about it? I think about it as from values to action. Right? Assuming I can get a little self-reflective, I can ask myself, what else does a value-based leader do? They look at things, second principle, in a balanced way. Because I could bring up a lot of topics today. We could talk about Obamacare, we could talk about the Middle East, we could talk about Syria, we could talk about a lot of things. Most people, when you bring up a topic, have very, very strong opinions. One of the reasons they have a very strong opinion is sometimes they don't take the time to understand the other sides of the story. And I actually slow down to say the other sides, because when I first started teaching 7 years ago, I said, the value-based leader takes the time to understand the other side. And one of the students said, does that make the assumption there's only two sides? And I said, great point. I'll never say the other side. There are multiple sides to the story. Some describe it as the value-based leader seeks to understand before they're understood. Okay? I may have a different view than Pat, but I will never say, Pat, I don't understand. That's sort of ignorant. If I take the time, I can understand. Then I can decide, do I agree or disagree? But that ability to really understand what is the situation in our town, in our community, in our world, what really needs to be done to look at this in a balanced perspective. So I have self-reflection, I have balance. The third principle, from my perspective, is what I think of as true self-confidence. And I think a lot of you have this, but let's just define this very carefully. Some people say, what's the true thing? You're either self-confident or you're not. Maybe you haven't seen this, but I've worked for a lot of people who can act very self-confident, who have no self-confidence whatsoever. That's the macho, do what I told you to do, I've never made a mistake crowd. When I talk about true self-confidence, I'm talking about something very different. I'm saying sitting back and realizing the obvious. There will always be people brighter than I am, more athletic than I am, more articulate than I am, but I'm okay. I know what I know what I don't know. I've been given certain talents that I'm supposed to use to the best of my God-given ability. I'll focus on what I'm good at. I'll try to get better at the things I'm not, but whatever I'm not that good at, I'll try, but at least I'll surround myself with people that are much better than I am. Not a new concept. This is that team thing from like thousands of years ago. Now, some would say, well, why doesn't this work very well? I think often it doesn't work because there's a lot of folks, unfortunately, that have a hard time admitting what they don't know, right? I run into executives a lot that'll say, Harry, I understand self-reflection, I understand balance, but Harry, I like to hold my cards close to the vest. I don't know if I want my team to know what I'm not that good at. And of course, I'm the one who has to explain. They already know what you're not good at, okay? All right? No show of hands, but if you ever had a boss, you couldn't write a book on what they weren't good at, okay? I mean, hello, they already know. So this whole idea of, guess what? I know what I'm good at, I'll try to get better, but I will surround myself. You know, I give the example to the students. I sort of have a financial background, so if somebody explains a financial concept to me, I get it pretty quickly. But I'm very well aware there's a lot of things I don't know much about at all. My wife always teases me. I've been living in the same house for many years, and somebody says, what kind of heat do you have? In my house, I have hot heat, okay? I've never seen the furnace. I don't know where it is, but I know what I know what I don't know, all right? But you got to know people that do. So you're self-reflective, you're balanced, you have true self-confidence. The fourth principle for me, and I think this is a hallmark every time when I go to Notre Dame and my daughter and I take a walk over to the grotto, it becomes pretty clear. This fourth principle is genuine humility. Because if I actually ask people today, how did you get to where you are? We have a lot of very successful people in the room. Often when you ask people quickly, how did you get to where you are? The two most frequent responses are, well, I worked very hard and I have certain skill sets. I work hard, I got certain skill sets. Now, those two sound like reasonable ways of getting there. I actually, on a personal basis, when I think of my career, I always add four more for me. One of them is luck. Hello, luck. A second is timing, being in the right place at the right time. A third one is the team. Because I didn't have the team I have, I never would have been promoted, and I'll never forget the people who helped me get there. And the fourth one, very important for everybody in this room, there's a spiritual dimension. Everything we've been given by Jesus, so let's never, ever forget that. And if any of those work for you, and at Northwestern, I have to be a little more careful about this church versus state. With you folks, I don't, okay? If we really know and understand that, then I think what begins to happen is we don't forget where we came from, because most of us start off with close to nothing. We keep things in perspective. We don't read our own press clippings. If we do read them, we don't believe them. We realize that every single person matters. And of course, some people can say that and don't understand it, but I think we really do. Okay, we've been very blessed. We've been very fortunate, right? And I think we've got a calling when we see what happens in other areas of the world. What difference does that make? So I'm very fortunate. My wife Julie and I are blessed to have 5 children. We're also blessed to have very good friends, Carlos Del Salto and Elizabeth Del Salto, that Carlos and I worked together for 25 years. He's from Ecuador, and he called me up a couple months ago and said, you really need to understand what David in this Andean health is doing and development. And Harry, you need to come down to Ecuador. We really need to spend some time on this. So I told Carlos, I told David, anything I can do to help, I will help, because this really matters. This is people that are saying, we're not waiting for somebody else to do something. And if we never forget where we came from, and realize every single day we're given we can make a difference, I think it has a lot to do with being a value-based leader. So I would never want to put anybody in this room under any pressure, but I will let you know, as far as I'm concerned, everybody in this room, you are those guys. So good luck. Don't let this organization down. Thank you very much.
I know we're a little bit on time, just a little bit. It's so dynamic with these two speakers, and Mike, if you would join us up here. So if you have any questions, just stand up and shout out so we can have their time just a little bit longer. If you have to leave, we understand, but if you can stay till 1:30, we have that opportunity for networking and questions. So, does anybody have a question?
That's a wonderful question, John, and as to most complicated questions, there are complicated answers, and I'll try and keep it simple. First of all, just so you know that the cost of the kinds of things we do in Ecuador are a fraction of what they are here. So a cesarean section is about $200 in Ecuador versus $10,000 in the United States. And the list goes on. A simple blood test is $2 here, it's $50. So costs are obviously much less. Obviously, income is much less than it is as well. The other thing that we spend a lot of time talking about that is actually cultural taboo to do, and for those of you who are physicians, when you sit in things like morning report in a hospital, which is the place where docs sit around drinking coffee, eating really bad, unhealthy donuts, talking about patients, we talk about their diseases, we talk about diagnosis and management. The one thing we never, ever talk about is the cost of a test and the financial and economic implications of requesting a particular test. In our hospital in Ecuador, when we sit around that table, it's always at the top of the list. The very first thing that we do out of the starting blocks with that patient is, on that board is, are they self-pay? Are they indigent? Are they from Social Security? Or are they from some other institution? And that drives the decision. Now, it doesn't do it in an unhealthy way. If someone absolutely needs a test, we do it. But there's a lot of gray area in medicine, and oftentimes we order tests in this country and around the world that may or may not be necessary. And so we always submit it to that economic question. It's always secondary to their ability, to the need. Again, if they need it, they get it. But if they don't absolutely need it, then they don't get it if we know that they're not going to pay for it. So that discussion happens on a day-to-day basis. The other thing that we've discovered over the years is that, and this is a really interesting piece, is that it's a community where the average income is about $1 a day per person. That's true indigence by anybody's criteria. And so the question is, how do you find resources then to pay for people's health care? And so we've partnered with Social Security, we've partnered with the Ministry of Health, we've partnered with farmers. So these farmers that work on farms, oftentimes they're owned by people from the capital that have some resources. The farmer can't pay for those services, but his employer sure could, and it certainly is in his best interest to keep his employee as healthy as possible. And if he waits to the 11th hour, it's just going to cost him more. So finding where some of that, I don't want to use the word wealth because it distorts what really happens, but finding those resources is what we spent a good 7 years doing, and that's why this place is now financially self-sustainable. Can you start tomorrow? We're ready. Thank you for that. Yeah. Yes, sir. Yeah, there really wasn't much of a model, and one of my board members says, "Don't tell them all the mistakes you made. No one wants to hear that." And John, maybe you're right, but I'm going to do it anyway. Yeah, the learning curve was steep from the time we opened our doors in the year 2000 until we were financially self-sustainable. It took 7 years, 2007. And we made every conceivable mistake possible. We could write books on how not to do it. We did all kinds of different financing schemes, but at the end of the day, we discovered that our best partner was right in front of us the whole time, and it was the Social Security system. And without getting into a long explanation on that, they they actually provide health insurance to all their to any employee paying Social Security taxes, and that percentage, the percentage of the country paying that, is going up and up and up every year. And so they're the ones that have been our biggest client. It's always a love-hate relationship, because the good news is that the cesarean section that costs us $200 to do, they pay us around $800. So we can use that surplus to cross-subsidize to take care of our indigent population. That's the magic behind this. The bad news is that they pay us a year or two later. And so we're in a constant state of financial emergency. But that's okay, because as Diego, who you guys, I would hope you'll be able to meet. Diego, could you stand up and just, this is Diego Adreda. Diego is our go-to guy in Ecuador, who basically runs everything that's related to Andean health and development in country on a day-to-day basis. And Diego is one of the smartest guys I know, and I've probably learned more from Diego than I've taught him. But the bad news is that we're in that financial state of emergency, but we probably should be that way, because we live in a community where people are in a constant state of financial emergency. So hospitals probably should kind of function the way communities live. So the first conversation actually happened my senior year at Notre Dame, when I realized I didn't want to be an accountant. I like to say it's a midlife crisis. Someone say, don't say that, say it's an epiphany, or make something like that. But I realized that I was struggling. I was one of those students I was just telling you about. I didn't know what I wanted to do with my life. I knew a lot of things that I didn't want to do. And as it turned out, Lorette Miller-Ruppy was our commencement speaker that year, who happened to be the director of Peace Corps, who happened to be from the Miller brewing family in Milwaukee. So I said, hey, I got a shot here. I can get into Peace Corps on Father Ted's coattails. So I went to talk to him about that. And so he said he'd see what he could do. Actually, that first time it didn't work out. And I learned later on in Peace Corps that whatever geographic site you want, never put that as your first choice, because you never get it, right? So, but then while I was in Ecuador for those 2 years, I went through a lot. It was a painful experience, seeing the things that you see in a place like that. And I used to write letters to Father Ted. And the last letter I wrote to him was right before I came back, and I said, hey, look, Father Ted, this is how this whole experience had affected me and what I would like to do, and I wanted to study medicine. And he had been trying to suggest that actually for quite a while during the 2 years that we were corresponding. And I finally said, I guess I'm going to try this. Could I come back to Notre Dame? It might be a useful place to do this. Maybe I could live in the dorm again. I could go back to Zam Hall, fake being an authority person like I was when I was an RA my senior year. And so he said, I'll take care of that. And so he did. He actually took care of the whole thing. And without making the story too long, Father Ted actually used the letter that I wrote to him and used it at a commencement address someplace in Iowa. And Ann Landers, who was a graduate of that university, who was also a very good friend of Father Ted's over the years, listened to the letter, heard the story, and then asked if she could help. And so she actually gave Father Ted the money for me to be able to go back to Notre Dame for those 2 years. And then just the final great Hesburgh Landers story is that after my 2 years at Notre Dame and took EMOL and all those kind of chemistry classes and so on and so forth, time to go to medical school, Ann Landers actually was at a luncheon in New York City with the people from Bristol-Myers Squibb. And they were with the Bush senior campaign trying to recruit her heavily to contribute to the Bush campaign. She was a staunch Democrat. She never knew why she was there in the first place. And in the middle of this lunch, she said to the guy from Bristol-Myers, hey, look, I got this kid that needs to go to medical school. He needs to go to Tulane because you can do public health and tropical medicine, and the problem is it's $25,000 a year. Do you guys have scholarships for that? And he was kind of irritated. And he said, no, we don't have it, but call my office on Monday morning. We'll get it figured out. I'll get him to $25,000 a year for 4 years. Now let's get back to this campaign. And so those are the Hesburgh-inspired moments. So Father Ted's ability to influence people, all I can say is I've been an incredibly grateful recipient of many of those things. And to Harry's point about humility, there's no way that it would be naive and foolish of me to stand up here and say that I've done all of this. It's all happened because of him initially and because of all the wonderful people that have been involved ever since then.
Okay, sure. Well, I always, one of the things I always tell the students is that I have virtually no answers, but I have, like everybody in this room, many, many opinions, many opinions. So, and this is something that my wife, Julie, and I talk a lot about, because if we're serious about it and you say, you know what, we're very blessed, we're very fortunate, we want to make a difference, what's the right thing to do? Well, when we all say what's the right thing to do, that makes one enormous assumption. What is the right thing to do? And I think that gets very personal. I think you have to pray a lot about it. But then when you think about it economically, I like to think of it as, how do you make the biggest difference you can make? And one of the things that always impresses me about the type of thing David's doing in this project, or things that I'm involved in Africa or India, the amount of dollars that you need to get unbelievable things done is significantly less than it would be in the United States. So if you're trying to think of, almost economically, where can you have an enormous impact, I usually think of it as some of these areas, and I think this is a great example. Now, here's another opinion. And some people may agree or disagree. That's why it's always good to call it an opinion rather than an answer. One of the problems I think we have in this country, if we want to be honest about it, think about the total insanity we've all lived through the last couple months in Washington, regardless of your party, regardless of your affiliation. You could step back, if you wanted to keep this very simple, and say, how could it be, how could it possibly be in the world's wealthiest country that we have an $18 trillion deficit? Now, people try to make this very, very complicated. I try to make everything very simple, which is, it's very simple. We spent more money than we had, right? It's a little bit like a family saying, we have this amount and we spent this amount. We spent way more than we had. Now, being in healthcare, and I'm sure David can relate to this, if you actually think about the problems we've had in the United States the last 20, 30 years, I'm being very economic now, okay? What's occurred, if you think it through, is that we've had a very unfortunate thing happen, which was up until 1965, for anybody in medicine or healthcare economics, the average American in 1965 lived to 65 years old. That's the way this was supposed to work. So the reason you got Social Security and Medicare is the thought process was, well, you live till 65, you take your first and only trip back to the homeland in Europe, and you come back and you die. That was the way this was supposed to work. The problem, and I'm being a little facetious, we're unbelievably blessed, right? We're unbelievably blessed because the average person in this room is going to live till 85, 86 years old. You may not be aware that the person born last year in the United States, on average, will live to 100, which means that 20% of the people born last year will live to 120. Now, here's a very simple economic fact. If you have a system that assumes that you're going to live to 65 and you're going to live till 90, it doesn't work, right? So very simply what you have to do, if you're a leader, in a very respectful way, you have to explain, I think, to somebody, you're 64, 63, we're not going to change the rules on you. We told you we're going to get this at 65. But guess what? If you're 55 or 45 or 35, this is going to be graduated, okay, so that you're going to wait a lot longer. Because if you think about it, a lot of people, a lot of my friends now, and I'm not talking about wealthy people that are in their late 50s, they're talking about retiring. Well, think about it. You retire when you're 55 years old, there's a high probability you're going to be alive and retired for longer than you worked. That doesn't work unless we want to become kind of some socialistic country, right? So people have to understand in this country, I think, if you really want to be able to figure this out, you're either going to have to work longer or you're going to have to save a lot more. So most of the problems that we have here, I think, are actually self-imposed. We've got ourselves in a situation, whether it's not looking at what the cost of testing is. Most of us in this room, if we buy a bicycle, we'll go around to 5 places before we buy a bicycle. But interestingly enough, we can spend $20,000 in a hospital and have no idea what the cost is because, well, the insurance company's paying for that. No, we're actually paying for it one way or another. So from my perspective, most of our problems are self-inflicted, which I think we could correct pretty clearly. But the place that I think we could do the most good are in places like Ecuador, where for a relatively small amount, we could make an enormous difference. That's just an opinion.
That's a great question, and I actually have a fairly strong opinion and not necessarily an answer as well. Over the years, as I've gone around trying to raise funds for this project in Ecuador, I've run into a lot of, for example, of my own classmates from the class of '84, and I ask them what they're doing, and they're doing incredible things. We've got moms that are running parent-teacher organizations at their schools, working in soup kitchens, doing an unbelievable amount of behind-the-scenes, unsung things. And if anyone wants to call me a hero, which certainly we don't feel like, I don't feel like, everyone that does this kind of work is a hero in their own right. And some people get some newsprint and some don't. And so I think what it comes down to is the word passion. What you have to do is you have to figure out what makes you passionate. And people ask me, well, why aren't you doing this in the United States? And my very scientific, intellectual answer is, I don't know. My answer is because my passion happened to be in Ecuador. For whatever reason, I was taken to that place, and I'm there, and that's where I feel like I've got my finger on the pulse of humanity in a way that I just don't feel like I've got it here. And I think all of us have to feel comfortable. You shouldn't do the things that you're doing in your communities if it doesn't make you feel good. It's got to go both ways. And finally, I'd say, and the question again, it does come up frequently, two things. One is teaching someone to fish instead of just giving them the fish is a very gratifying and I think very important thing to do, and I think we're able to do that in Ecuador. And the other thing is, Jesus said, it's whatever you do for the least of my brothers, you do for me. And so I just feel like the least of our brothers are a lot of those people that we're taking care of in rural Ecuador.